Good work provides several things to people. It provides access to the resources of daily living through income or wages, social participation and interaction with other people, and it can also provide a sense of purpose or fulfillment. We've seen a rise in insecure work over recent years, which has negative health impacts. We've also seen a rise in legislation to promote diversity in the workplace, which can protect people from bullying and harassment, although we still haven't fully tackled these issues. And also we're seeing an increasing threat to jobs from automation and so on. A lot of the work around automation has focused on the number of jobs that are likely to change in the future, and very little work has been put into how the nature of employment itself might change. So will there be such a thing as jobs in the future? And actually, if that nature of employment does fundamentally change, then the evidence-based linking work and health would also fundamentally change. And we need to go back to those core concepts that link good work and health around autonomy, dignity, access to resources and so on.